Welcome to the Poisoning Podcast. I'm your host, Erin DeLulo. Please like, review, and share this episode with a friend. Today's guest is Mary Hennigan. She is a journalist with the Arkansas Advocate, and she's covered many issues: food insecurity, COVID-19, and state politics. She received her bachelor's and master's degree in journalism from the University of Arkansas. So before we get to the show, two quick disclosures. I talk about it often, but I mentioned Harbor Path in the show, the nonprofit that distributes Naloxone and has done so through healthcare providers in the state of Arkansas. And then we talk about the Attorney General of Arkansas, who I advise on his political campaign. So I just want to disclose that, and I hope you enjoy the show. Mary, welcome to the Poisoning Podcast.
Hello, thank you so much for having me.
Oh, this was just such a surprise to find your story this week. And I thought it was just well done with just basic facts on naloxone, which I think all of our normal listeners will think of naloxone as Narcan, the most common brand name. But it shows what's going on in your state. But I don't even know if you saw, I've been saying from Massachusetts to Mississippi, it is hard. It has been documented that it is hard to find naloxone, which is a pharmaceutical drug, at the pharmacy. So can you start off by telling us a little bit about the work you did in this piece?
I would love to. So for the Arkansas Advocate, which is part of State's Newsroom, I talked with 15 pharmacists in rural Arkansas. And just as a little broad overview, Arkansas is generally a pretty poor state. There's about 17% poverty rate. And as I was talking with these pharmacists, one of the main things that they told me was that affordability to the medicine was a huge barrier for people. So as you probably know, naloxone was approved to be sold non-prescription about 2 years ago. So what that means is anyone should be able to go into a pharmacy, take it off the shelf, purchase it, and take it home. But what I found in my article was that a lot of pharmacists in rural Arkansas are keeping the product behind the counter, which means that any customer who comes in typically will have to ask for it. So there's also a barrier of that. The reasoning for keeping it behind the counter, there's a couple different things, right? But one of the things I found most often was that the business owners were worried that people would shoplift the medicine because it is such a varying and expensive drug. And so that's something that, as a business owner, you don't want someone to come in and steal your products, but still it is creating, I found, some of that barrier for access.
And retail crime is a big topic in the news lately. Some pharmacies, probably more in intercities, are locking everything behind, lockable cabinets, no matter what it is.
Right.
Is it? So that is I understand fear. So did you find out if the burden of stolen product is on the pharmacy owner? Is that where the financial burden rests on them?
So I believe so. Because most of them kept it behind the counter, there weren't many instances where someone had stolen the medicine. And so they kept it behind the counter without ever putting it out on the floor. So I don't think that they actually came to reality with shoplifting. It's more of a concern, a fear, something that they avoided completely by keeping it behind the counter. But I did speak with a pharmacist who mentioned that if it had expired on the floor, they would have to eat that cost. And so if those two are comparable, I think that the same thing would account there. So they would have to pay for it if it was stolen.
Oh, fascinating. They'd eat the cost if it's expired, which it's a 3-year shelf life now for those who aren't aware. The FDA extended it from 2 to 3. Wow. Well, in our was it last week's? No, pre-Easter spring break holiday, we had Dr. Stephen Lloyd on the show, famous, right, of the Dope Sick book, and he's actually the drug czar here in my state of West Virginia. And he told me, Erin, if I had a Narcan that was 10 years old, I'd still try it on someone if I thought they needed it. So it's probably not useless, but I get rules are rules for a reason. And $60. Now, let's talk about, I'm going to stop there because we're going to come back to these pharmacists. So it's been over the counter for 2 years. And is that around the same time Arkansas has been seeing overdose deaths decline?
So that's interesting. A separate story I had written for the Arkansas Advocate noted a decline in those overdose deaths. And Kirk Lane, who runs the Arkansas Opioid Recovery Partnership, and that's basically just they took opioid settlement funds, pulled them together, and made this group, and they do a bunch of funding for programs. And Lane told me at the time that he thought that some of the decline was because of access to naloxone. And through the settlement funds in Arkansas, they're being distributed through the Attorney General's office and then also through the recovery partnership that he runs. And so, with both of those, naloxone is getting out to law enforcement groups, emergency organizations, local groups who have, I would say, partnerships with like food banks and things like that that
Hmm.
are really getting into the community that needs it. And so, while I reported that a few months ago, and I don't know an exact update today, I did note in the story that we're mostly referencing today that there was a decline for 2023 to 2024. So it does continue to decrease.
So there seems to be a correlation
There seems
potentially.
to be, that's what the
There you go.
experts say.
It's hard. I've interviewed several people with the decline. There could be several reasons, but I do believe there is something with naloxone just being out there more and available to people. But I believe you even Mr. Lane even mentioned there was because there's a stigma to substance use disorder that some people still may not want to purchase it or even have it in their possession if it was free.
Right. So, because naloxone is associated with opioids and substance use disorder, people kind of feel weird about having it around. They become defensive of people thinking
Mm,
that they may have a problem overusing drugs. When really what I heard from pharmacists is that they just want it in the house in case. What if a child gets into the medicine? What if a
right?
family member is looking for a Tylenol and grabs the wrong thing, takes too many, something like that? But if you have it in the house already, you're prepared for something. And so, with that stigma attached to the medicine, they're trying to turn the narrative away from the person using the opioid and saying, like, maybe you don't have an addiction problem, it's okay, but think about everyone else who may accidentally access this medicine in your life, those people that you want to protect. Because often, most humans, I think, care about the people around them instead of themselves. They think, oh, I'm okay.
Right. Or, the DEA is doing a whole campaign called One Pill Can Kill.
Mm-hmm.
So, even though we all like to think our family and friends are not consuming illicit drugs that could be tainted with fentanyl, carfentanil. I mean, now there's so many types of stronger fentanyl in these drugs, isn't it? For, I mean, let me tell you, we'll get into the pricing of this naloxone, but is potentially saving someone's life, worth having naloxone in your car, or I have one in my purse that I carry with me. You know, um, do we not just love everyone enough to give them a second chance? Is my viewpoint of it, but I don't know that many people think that way, like as a just in case medicine.
Sure. And a great quote that Lane told me while I was reporting for this is the stigma is what's always made it difficult to give us resources to people who need it. And so in the past, current, perhaps maybe even the future, this stigma could continue and just also create another barrier to giving help to people who need it.
Hmm. So true. So the title of your piece hits insurance, right? It
Mhm.
really does. So let's talk about what you found with insurance companies. covering this medication?
Right. So, as I mentioned, Arkansas is a poor state. And I looked up prior to this the statistic for people on Medicare, and it's about 670,000 people rely on that for their insurance. Arkansas only has about 3 million
Oh,
people
wow.
living there, so that's a big percentage of the state.
Hmm.
And as I was talking to pharmacists, I was asking my main questions of, do you have Narcan or Naloxone in a different brand? Where do you keep it? Why do you keep it there? The things that I was trying to prove with my article. And then they were the people who brought up, finances is a huge barrier and
Sure.
insurances aren't covering it. We could have 10 prescriptions come through in a month. Let's just use that as an example. And less than 50% of them will take the medicine because they don't have the money to pay for it. If the if the medicine is $50, they have to decide, can I spend $50 on something I may not use, which is something that may be a fair assumption, or should I buy dinner for a week? Should I feed my kids? Can I drive them to school? And that's a real reality for people in Arkansas.
I'm going to pivot. You did, which I thought was like a fun piece, but a sad piece and a heartwarming piece about the deer hunters.
Oh, yeah.
And I think this hits to your point. And so you did this great story about hunters in Arkansas coming together, donating the deers to be processed into jerky. Am I saying that right? Is that what they would
Yeah.
call it?
They
Or
call
deer
it a
stick?
snack
A,
stick, but
a
we
snack
would call it
stick.
jerky. Yeah.
So high protein. Venison is a great protein, low fat. Um, and you interviewed, I think, a teacher who said for the first time kids were requesting food items for Christmas. And that
This is
they,
true. Hmm.
I mean, I almost like cried and I just wanted to scream at the same time. But when I want, I think that story puts this into perspective on if a family member or if a family has to think about having a box of naloxone or a food.
Yeah. And by the way, thanks for reading that story.
Yeah.
It was I read about food insecurity a lot when I was reporting in Arkansas, and I always learned something different when I did it. So, that guidance counselor I spoke with, she helped do the backpack program at the school. And she said for the first year, kids were asking for food for Christmas that she saw. And, when I write this story about naloxone, I could mention that the poverty rate and things and people's struggles, but it's such like a multi-layered problem that if you decide to pay $50 for the medicine or if you don't, it's hard to get people to relate to how they're actually living their life, like you've just explained, of taking that and spending it on food instead of having the medicine around.
Let's talk about, is it Eudora? The
Eudora,
income levers
Arkansas.
there.
Hmm.
Yeah, and feel free to like read from your piece. I found the income level in Eudora. I mean, I live in, I don't live in what would be considered a wealthy state, West Virginia. I think we have a lot of similarities,
Hmm.
but please share.
Yeah, so Eudora is a really tiny town of about 2,000 people in the Arkansas Delta. And the Delta is basically where the Mississippi River does the squiggly line between the Arkansas and Mississippi state borders. So the town's median age is 52, which is an aged population, and
Yeah.
their average household income I found was $27,000. So the pharmacist that I spoke with there, she said that the area is high crime, and while
Mm.
naloxone is an important resource to have, she said, quote, "We just don't want to take any chances with having naloxone out front. Of course, if there were any emergency, it would be easy to get to if that was the case." So while it is still available behind the counter, like I've mentioned multiple times before, it's creating that barrier. But as we stated with the pharmacies having to eat the cost, it's something that they have to decide as a business owner. And she said that the price for naloxone at her location was $250 when we talked.
I
And
saw that. Mind blowing.
it's shocking, and that was the biggest outlier of my reporting that I did. So of course I had to include it. It it mostly ranged around $60 per pharmacy, but it varies. It just varies.
And were these pharmacies, they were more independent pharmacies, correct? You weren't walking into a pharmacy in a big box store like a Target or a Walmart.
Right. I specifically avoided those because those are more of like a controlled environment where
Mhm.
store per store the price will probably be the same. I did go to a couple local Walgreens in my area while I was living there, and they were on the shelf and available. Same at Target. And so but you don't have Target in a town of 2,000 people in rural
Right.
Arkansas. You've got one family pharmacy, and that's what you
Mhm.
depend on for all of your medication. And so if they don't have it, or if they don't carry it, or if they carry it in a more difficult location, that's the hand that you were dealt, and that's where you live. And it's likely that because of your income constraints and other social determinants of health, that you're probably not going to be able to drive somewhere with a Target. And I don't know the nearest Target to Eudora, but it's likely over an hour. And that's just not something that
Well,
is,
I'm trying to be equal here. I know the big box store in Arkansas is called Walmart.
it is
That's where its
Walmart.
headquarters. Um, I almost wonder, I've seen this with independent grocers. Um, I think the independent pharmacists are at a potential disadvantage. I don't know for this for a fact, but I've seen it in the grocery space where when you're a big box grocery store, you're so big, you can only pay your suppliers as the product is scanned. So if it's stolen,
hmm
the supplier eats the cost.
So the pharmacy then would be off the hook.
I wonder if it's the same. I have not, and I just came up with this thought. So guess what? I've got something to look into now. But in independent grocers, they don't have the ability to, or the muscle to get that same type of terms. They have to pay within like 30, maybe 15 days of receiving product. So if it's stolen, it's on them. And I've known this. So I wonder how that applies to the pharmacy space.
hmm
Something to look
Something to look
into,
into.
right? I know, and I can't imagine that the margins on being an independent family pharmacy are large.
They did tell me that they were small. You're purchasing it for $35 maybe, and you're selling it for 40 or something. You're
Yeah,
not making a lot of profit on something like this.
sure. No, that makes total sense. I think I mentioned in my Substack before, and I have there's naloxone in my cars, in my house, in my purse since I work with a nonprofit that distributes it. I am a believer and you could save anyone at any moment because this is our biggest killer of 18 to 40-year-olds in America. So in West Virginia, I went to my CVS where they didn't have it out. Um, and I paid $77 a box and I have the receipt for it.
hmm
And it wasn't even name brand.
hmm
And most public interest price, I like to just educate our listeners for generic naloxone, it's like $26 a box.
That is way lower than any price any pharmacist mentioned to me during my
Yeah.
reporting. It was definitely in the 50 to $70 range for the average. And that's just
Wow.
not affordable for the folks in Arkansas.
Well, you know, I always feel like I'm talking about the things that we need to fix in my podcast and Substack, but there are good people doing good things too, and we should also highlight them. So you talked to um, a friend of the show here, River Valley Medical.
Mhm.
Did you talk to Dr. Martin or talk? There are two Martins that aren't
There are two.
related at this healthcare facility. They're great people, not related, not married, and not siblings. So, who
Right.
did you speak with there?
So I talked to Tucker Martin, who's the
Okay,
chief operating officer, and he's one
great.
of the co-founders of the acronym is ARMOR, which is really helpful to remember, but the real name is the Arkansas Mobile Opioid Recovery Nonprofit. So basically what they did is had this idea to put resources in, a mobile van. So healthcare resources, substance abuse disorder resources, mental health. And they're actually transitioning to some pregnancy resources, which is only something that we talked about briefly. But along with Arkansas having the highest food insecurity rate, it also has the highest rate of maternal mortality. And so that's
Yes.
something that they're tackling as well. But Tucker told me that the Attorney General funded this first mobile unit for about $770,000. And really, that was launch off money. Go take it out and see what it does. And if it works, that's really cool. And it worked. So, a group of healthcare professionals, I don't know exactly how many they put in each unit, but they drive this thing up and down interstate corridors in Arkansas and touch on those really tiny towns. And they partner with churches or food banks that already have been established in the community, and that's like their access point into getting the people that really need care their resources. So it worked great. They launched about a year ago, so April 2024. And only a few months after launching, they got a second unit. So the Arkansas Department of Human Services decided that they would spend the same amount that the Attorney General did, and they got 2 units. So I have the statistics in my article. Let's see how many people
Please.
they helped in the first year. So in a handful of Arkansas towns, they treated 1,785 patients. And the treatment varies. I don't have exactly what those treatments are, but it's people who need help in the substance abuse world.
Yeah.
And also during that time, they gave out 1,200 free Naloxone kits. So this is a program that is helping bridge the gap between people who need the medicine and can't afford it. So they're giving them away for free.
Yeah. Well, I will say Harbor Path, the nonprofit I work with, we provided some of that
Right.
naloxone to River Valley, and but they are getting it out there to where people need it, and they're doing, in my opinion, amazing work. And let's replicate that in 50 states, folks.
Hmm.
If people have a hard time getting to a healthcare provider or a pharmacy, I love this mobile unit idea.
Yeah, same thing with the social determinants of health of not being able to drive to the Walmart to get the medicine. You can't drive to a hospital in some towns. And so this is really helping bring those resources to super, super small towns in Arkansas. I mean, some of them could only have a few hundred people, is how small we're talking.
It's a great use of opioid settlement dollars,
I think they would
especially when
agree. Yeah.
some states aren't using it to directly abate the crisis. This
Hmm.
is.
Hmm.
So, cheers to everyone involved there. I can say that. So, now, I mean, that's a great solution. I love it. Were there any other positive stories that you discovered in reporting
Yes.
on this issue?
Yeah, so one that's fun to mention that didn't make it into the story just because I talked with too many people. I can't give something from everybody when you have 20 sources. There's a small town called Truman, Arkansas, and
Mm-hmm.
as I was talking with the pharmacist of a local pharmacy, she mentioned that, in Truman, there's not really a stigma around this. We have one of the highest overdose rates, and we just want to help people. So we're just getting it out, and anyone who wants one can come in and get one. I don't care. Like, I'll help you pay for it. Just come on in and come get it. And so she was telling me that she had a patient or a customer come in and she was replenishing her naloxone kit because she had used it on a friend.
Wow.
And the pharmacist was just like, this is how it goes around here. You come back in and you get your kit and if you need to, you use it.
It's very realistic.
Hmm.
No, there was, I think one of the takeaways from reading your story and a few others about different states is policymakers who are trying their best. Do we want to save everyone? Yes. Is that practically possible? we can't be perfect, right? Nothing is perfect. But you should do everything you can. And there was one where, a gentleman, one of the policymakers said, well, we've distributed a handful of free naloxone kits at some pharmacies. I read that in your piece. Um, and I thought to myself, well, if you can't afford it, how are you going to know where it is? I mean, it's great if if pharmacists aren't getting the demand, it's probably it's a stigma and it's potentially an education problem. I feel like we just have to be out there handing it out, putting it out there. I'm not relying on people to sort of think about it in their day-to-day lives, because if you have to open an app to find a group near you that might have it and then contact them and see, it seems like a multi-layered step. And if I'm making $37,000 a year for my family, that's not a priority of my
Right.
time.
Right. And some people did tell me that the people who are seeking out naloxone are most likely friends and family members of people who are using opioids, and so they're not the people themselves. Um,
Well, that's great.
it is great, yeah, and having the resources is good. Something also that I didn't write, we do journalism to make a difference, or at least I do. You want to have a positive impact somehow in the community, and some pharmacist told me, I hadn't, before you called, I hadn't even thought that maybe I should put it out on the shelves. And so maybe I will. Or maybe I'll keep it behind the counter, but I'll just put a sign outside, like we have it. And
Yeah.
so just that step, I think, is a good step in the right direction, because even if they're still concerned for their business and for their profits, they're educating, like you said, they're getting the word out.
Yeah. Yeah. No, that's wonderful. That's so great to hear.
Hmm.
That you made someone think a little differently. No,
Hmm.
I did not know the Arkansas Advocate was related. Like every state
Hmm. Yeah.
has a chapter, but we have West Virginia Watch here, which
Yes.
is a great source of information, especially during the legislative session.
Hmm.
So I really enjoy finding publications like that.
Yeah, the Arkansas Advocate does a great job of covering policy and naloxone policy. Specifically, I know that the state has implemented it for each prescription with opioids. You also have to have an accompanied naloxone or anti, what is it called?
Antagonist? Oh.
Yeah, yeah. So you also have to have that. And then
Antagonist.
schools are required to have opioid kits as well.
They
And so
are, but
that's,
I don't think they funded that legislation.
well, I will have to look into it. That's the
Yes,
next
I think that
step
would be
to
a
this.
great next story.
Yep,
And
that's the
that's
goal.
happened a lot around the country where the legislature will pass
Hmm.
that the schools, especially like middle schools, high schools, and then
Hmm.
even, I know in like Eastern Kentucky, we put naloxone in the schools and they wanted extra so they could provide it to some families who may be at risk. Or, yeah, I mean, there's just so much need. But I've seen in many other states this happening where great, they have the bill passed, but then the Department of Education doesn't have the funds because they didn't include a funding mechanism. I wish everything was so easy, but there's always many layers, right? To
Hmm.
these things.
Right. And so I'm not exactly sure, like at this moment, what Arkansas did, but I know that they're at least pushing for that, which is a thought in the right direction, we could say.
I love to hear it. I love
Hmm.
to hear it. So I ask almost every guest on this show, since it's called The Poisoning and it's about fentanyl and opioids and illicit drugs, do you carry naloxone on you, either in your home, your workplace, or your car?
Mhm. So I currently do not.
Okay.
And for me, it is a financial barrier. And so
Ah,
it's interesting. Also, as a journalist, I don't put myself into these stories, but that's something right now in the position that I'm in, I just don't have the appropriate funding source for that.
Well, if you give me a mailing address, I can change it.
Okay.
Everyone should have it because you never
Mhm.
know who you can help. So tell us, is there anything else you'd like to discuss on the piece? I've really enjoyed having you on, Mary.
Oh, thank you so much. And again, for having me. And I think that one of the most important things that is should come through for this article is that the pharmacists, while they're saying that their clientele has not really demanded it and they're keeping it behind the counter for their own concerns, they're doing a great job of providing things to their community. As I've mentioned many times, Arkansas is rural, and when you're a rural place, it's all hands on deck. And those people will help you pay for it if you're in a situation where you really need it. I think that that's something that will go outside of their profession a bit. You give out of your own pocket in Arkansas a lot of times, and so I know from talking to them that if it's a situation where you really need it, you'll get it, or you'll find a program where you need to get it. It's just not in exactly the same way of it being out on the shelf and having the same access to it as you do maybe in other states.
No. Well, where can my listeners follow you?
Sure, you can follow me on X or Blue Sky. I'm at Mary Hennigan _ on X and no _ on Blue Sky.
You got there early on Blue Sky, didn't you?
I did, yeah. I didn't have to add that little thing at the end.
Well, thank you for coming on the show, Mary. This was fun.
Thank you so much, Erin.